The Pregnant Care Show is proudly brought to you by
Cerelac. It's all good, Mom.
When a healthy pregnant woman at term or for any medical or obstetric reason need to start or go into labor not from the natural onset, an artificial means is the option considered. That is called induction of labor. It's the process of artificially stimulating the uterus by the use of a drug in order to start labor with the goal of a healthy vaginal delivery after all assessments done on the pregnant woman and the unborn baby proves positive. Induction of labor is perhaps unique because it seeks to advance a process which in the natural course of events is inevitable unless pregnancy is terminated by a cesarean section. Welcome to another episode of the Pregnancy Care Show. On today's episode, we'll be looking at induction of labor and everything we have to know about induction of labor. For today's episode, I have with me Dr. Sekom. He's been on the show before and he's here again. Hello, Dr. Sekom.
Hi, Dede.
Welcome back to the Pregnancy Care Show once again.
Thank you, Dede. I'm happy to be here.
Okay, so our viewers, I think they specially requested for you, so thank you for coming.
Thank you.
Anything you want to tell our viewers before we start?
I'm happy to be here and then happy to be part of this pregnancy care show. One of the things that we are happy as doctors to have now is patient-centered care. We want to put the patient in the interests box. We want you to be our focus. So we want to do everything to make you happy. My name is Dr. Sekom, an ONG resident at Greater Accra Regional Hospital, and also a manager of Sekom Medical Center at Musuku near Kwabenya.
So you've heard it all from Dr. Sekom. We'll go for a short commercial break. When we come back, the show still continues. But then the show is brought to you by Cerelac. Welcome back. If you just join us, it's still the Pregnancy Care Show brought to you by Cerelac. On today's episode, we'll be looking at induction of labor. Before the show starts, it's quite funny how people say induction of labor is painful than going into a normal or spontaneous vaginal delivery. I don't know how true that is because I haven't experienced that yet. But doctor will tell us if that is true or not. So Dr. Sekom, we would want to know, what is induction of labor?
Naturally, every woman, when you are pregnant, after 37 weeks onwards, most of the times, the baby that you have formed inside, when it's inside, we call it fetus.
Okay.
It needs to come out because the placenta that is giving the baby's food is tired.
Okay.
The baby has grown so big, it's not enough for the baby. So the baby has to come out. So God has made in such a way that naturally, from 37 weeks, a lot of women, about 38 weeks, 39 weeks, they will go into what we call spontaneous labor.
Okay.
They go into labor themselves and the baby will come out.
Okay.
But in some people, this is not the case. Either something has made it necessary that the baby comes out early, or it's important that this baby has kept too long there. The baby has to come out. So what we do to stimulate labor before it occurs naturally is what we call induction of labor.
You made mention of 37, 38 So when do you do it? At what stage of the pregnancy?
So for us, somebody will go into labor. There are two things. When a woman gets pregnant,
Okay.
the baby has to come out.
Yes.
So when the baby comes out before 28 weeks, we call it abortion.
Okay.
When it comes after 28 weeks, we call it we say that you have delivered.
Okay.
After 28 weeks in Ghana, we say you have delivered. Now, there are some things that can make the baby need to come out after 28 weeks.
Okay.
So if after 28 weeks, there are some things, and those things are problems that will can happen with the baby,
Okay.
or there could be challenges with the mother. So after 28 weeks, when you need to cause the woman to go into labor, so the woman can, with the aim that the woman will deliver, we are inducing the labor.
Oh.
So it can happen after 28 weeks. Before 28 weeks, we will not call it induction of labor. We'll call it maybe induction of abortion.
Oh, okay.
After 28 weeks, you say you are inducing labor if you need to.
Oh, okay. What could lead to this induction of labor? What are the reasons for having an induction of labor?
So commonly, most of the reason why we do induction of labor commonly is when the baby's date has passed.
Okay.
And the woman is still not going to labor. And then for us, what we normally use as a mark is when the woman has done 41 weeks plus maybe some 3 days going. So when the woman has done 41 weeks plus 3 days, we said, no, this baby, now we think that the placenta cannot support this, the baby inside there. So the baby needs to come out. So the commonest reason why we do induction of labor is what people will call post-date.
Okay.
Or others will say prolonged pregnancy. Pregnancy now is gone too far. The baby has to come out.
Okay.
That's the commonest reason. Now the other reason is that, say the baby has died in the woman's womb.
Okay.
In that case, you don't want to go and cut this woman who's lost the baby. We call it IUFD,
Okay.
intrauterine fetal death. In such a case, you want to let the baby come out. We call it induction of labor. So the baby will come out. Sometimes this baby might have a problem. So I'm talking about some of the issues that can happen with the baby.
Okay.
So the baby might have a problem, a congenital abnormality. But when this baby is born, this baby most likely cannot survive.
Okay.
So the reason that the remaining part of the pregnancy, do you want the baby to go and continue? No. So you give the woman some medication, and so the baby will come out. So these are all reasons about the baby that you want to yes,
Start the labor.
start the labor for the baby.
So, Doc, which woman is eligible to undergo an induction of labor, and who also is not eligible to undergo? Every pregnant woman can undergo induction of labor.
Thank you, Dede. So the woman who can undergo induction of labor is somebody who has not had a cut on her uterus.
Okay.
So if the woman has had previous operation on the uterus, on the womb, the woman is not supposed to undergo induction of labor.
Okay.
So you have done operation before, you've had one previous CS, you can't. Ectopic. Some ectopic, it happens very close to the uterus.
Okay.
And then somebody who has had previous operation like myomectomy, the person had fibroid, and you went to remove the fibroid from the person's uterus.
Okay.
When you do that, you create a scar on the uterus.
Okay.
So when you go and induce it, it can burst.
Wow.
And then any woman who is not fit, when the woman is not fit, the woman who is ill, the person is ill, maybe the person has had cardiac problems, heart condition in the pregnancy. You didn't want to go and induce and put so much stress on this woman. And the woman, anytime you realize that you need to deliver this woman within a very short period, it might not be good to do it. And some women naturally, they have what we call small pelvis.
Oh, okay.
The place where the baby will pass is small. The baby cannot pass there. We call it contracted pelvis.
Okay.
So because it's so small, the baby
cannot pass through.
And also we are looking at when the baby's position is not good. in the womb.
Okay.
The baby that is coming with the legs, it's dangerous to go and then induce. So they have to be careful.
Okay.
Also, if the woman has something that is blocking the lower parts of the woman's abdomen, like a fibroid that is the lower part,
Okay.
they will not allow the baby to come down. You really want to go and induce her. If the woman is bleeding plenty in the pregnancy, there's one condition called placenta previa.
Okay.
When the placenta remains low in the uterus, you really want to go and induce such a woman. You have to be careful. So these are all some of the reasons why you really want to induce a woman.
Okay. So from what you've said, that means before the procedure, you do assessment. So what are some of these assessments that you do? Maybe just a short one on that.
So right from the beginning, when the woman is, you know your client.
Yes.
During antenatal, you know the person's history. So when a woman comes to antenatal, we do some examinations.
Okay.
One of the things that we check your height.
Wow.
Then we take some history. So before you even get to us, would have known some few things about you. When it comes to the time when we want to consider induction of labor, one of the questions we ask is that, is there anything that will prevent that needs to prevent this woman from delivering herself?
Okay.
So if this woman cannot deliver herself, there's no need to go and deliver her. If all these things have been ruled out and you think that this woman can deliver herself, then we go ahead to examine this woman. So something we call Bishop's score.
Okay.
So we examine the woman's pelvis. There's something that we use to check the woman, to check if the woman, the mouth of the womb, we call the cervix,
okay,
if it's good enough and can support this labor.
Induction. How safe is an induction of labor?
Generally, induction of labor is safe.
Okay.
If you are in the right hands. Because as I said, before the induction, the doctor must assess you to be sure that you qualify for the induction.
Okay.
And there are no contraindication. There are not things that should stop you from having the induction of labor. And there are not things that should prevent you from having vaginal delivery,
okay,
delivering yourself.
So, okay.
So if these things are taken care of, most likely it's safe.
Okay.
But of course, we need to monitor you during the labor period.
Okay. So from what you just said, is there any special care given to women during that process, or a woman who is undergoing an induction of labor? So during that process, do you give them any special care, or you just manage them like a woman who had come into labor herself?
So most women will have the basic care they need.
Okay.
But of course, when somebody is having induction of labor, you have used medicine to stimulate the uterus to contract.
Okay.
So it means that this uterus can burst.
Wow.
So then we need to give them extra attention. You are putting too much pressure on the uterus. The uterus can squeeze the baby more. So that can put pressure on the baby too. So this baby needs to be monitored closely.
Okay.
So we monitor them closely. So during the induction of labor, every 30 minutes, somebody can come and check your baby. Or like every 1 hour, come and check your baby's heart. The baby's heart is beating well.
Okay.
There's a midwife that is close to you, monitoring you. Always be sure that this baby is doing well.
Okay.
The mother is doing well. Sometimes we'll be checking your BP more frequently, checking things about you to pick that there must be a problem.
Okay.
If there's a problem as early as possible, we'll pick it up. So there's close monitoring for people who are they need to be monitored. So if you are in a facility where this monitoring cannot be done well, then you have to send a client to a place where this monitoring can be done well.
Okay.
Because we need to have a healthy baby and a healthy mother.
So before a commercial break, how painful is an induction of labor?
So labor itself is painful.
Okay.
One of the definitions of labor is onset of painful uterine contraction. So labor itself is painful. By induction, you are using medicine. The one that we use medicines for.
Okay.
So that medicine will make the uterus contract. And it's likely to be more painful. But nowadays, we have advanced though. So we try to help the women with pain relief.
Okay.
So it's not as, people don't get scared. You can discuss that with your OBGY. Sometimes we can do some things to help reduce the pain during labor. So it's not all entirely. Of course, Induction of labor will be more painful than the ordinary natural way of it, but we can help you.
Okay. So induction of labor is not entirely that painful because doctor says they can help you when it comes to pain. There is lots of pain management during this phase. Let's go for a short commercial break. When we come back, we'll hit the streets to find out what our viewers have for us.
In the first 2 years, your baby will experience amazing growth in so many ways. To fuel it, they need the right nutrition. With Cerelac, 1 bowl of goodness a day provides the wholesomeness of carefully selected grains, the Iron Plus, which helps support brain development, and the yummy taste baby loves, assuring you the right nutrition in 1 bowl. Cerelac, it's all good, Mom.
This advert is FDA approved.
Welcome back. If you just joined, it's still the Pregnancy Care Show brought to you by Cerelac. Let's take some questions from our viewers on the streets.
My name is Betsy and I would like to ask Doctor, will induction of labor fail? And when it fails, what's next?
Within the year 4, me kasa odan for my market. Nampese me to my doctor na doctor tin ho asese. E ma no mo kwa wo no a doctor kase be ye omo operation. E di ahoboa e na ese omo deba na ye omo operation.
Your friend me pal, me hear more down to my market. Doctor Mpacho, person maybe say, come from my induction of labor and now.
So, Doc, these are some questions from our viewers. So, a viewer would want to ask, will an IOL fail? And if it fails, what's next?
So induction of labor doesn't always fail.
Okay.
It can fail sometimes. So when we say that it has failed, when you have tried it once, it doesn't work. Like we normally will give the medicine like every 4 hours.
Okay.
Depending on the person, every 4 hours for about 5 or 6 times. If it doesn't work, they will ask the woman to rest. Maybe for like 24 hours. They will start again.
You start all over again?
Yes.
Wow.
If we do this maybe on 2 occasions, it doesn't work. We see that it has failed. Of course, if the baby is inside, baby has to come out. So then it means that we will be left with only one option.
Okay.
Than to go and remove the baby yourself. You deliver the baby through the abdomen. That's what we call cesarean section.
Okay.
So when induction of labor fails, after you tried once and twice, that's failed.
And the
you
next
must
option.
yes, to maybe to do a cesarean session for the woman.
Okay. So our next viewer is asking, how well should the couple prepare before this process?
So emotional preparation, it could be challenging because most women might be expecting that maybe the commonest cause is prolonged pregnancy. So maybe post date. All people say post date. So I mean, it will be challenging to the couple, but naturally there should be no fears much. There should be no fears much, and then the woman should also talk to his or her OBGY and ask for a possibility of getting some pain relief. Okay.
So our last viewer is asking, are there any alternative to an induction of labor?
So the baby has to come out.
Yes.
So there are 2 ways that baby can come out. Either baby is coming out through the vagina, or baby is coming out through the abdomen. Cesarean section. So those are the 2 main ways that the baby has to come out. Okay. So if you do induction of labor, it does not work, then you might have to look at the cesarean section. But even the induction of labor, you can combine multiple approaches. Okay. You can combine, maybe sometimes you can combine the surgical method to the medical method. all in an attempt to help bring the baby out.
Okay. So I hope that our questions have been answered. So let's move on, Doc. So do we have types or forms of the induction of labor?
Yes. So we have types of inductions.
Okay.
So we of course have the medical induction.
Wow.
Then we also have the surgical induction. So in medical induction, we use medications.
Okay.
Yes, we use medications. So when you come, we assess you after assessing you. Then we use some medication. We put some of them we can put on your tank.
Okay.
Some of them, I mean, I'll mention them all. So you put under your tank.
Okay.
Or you go and put it in the person's the vagina behind the cervix.
Okay.
Yes, we call it posterior fornix.
Okay.
You go and put it there. And you're monitoring the woman. So that's what we call the medical management.
Okay.
The surgical management, sometimes what we can do is that when the distance is a little bit open, we can put some things there. We can put some substances. When you put there and then the thing absorbs water, it begins to swell.
Oh, okay.
So as it swells, it opens the cervix. And some of them, it might stimulate labor for them.
Okay.
Sometimes too, when the cervix opens small, you can go and then rupture the membrane around the baby. The sac around the baby. That holds the water.
Okay.
You can go and rupture, the water will come out. And some people, it stimulates
the labor for them.
It's other times to be something we call catheter. You go and put it there. And then you blow it. And you put some pressure, pull on it small.
Okay.
Some people, it opens the service for them to go into labor.
So I think the commonest one we know is the medical one, the one they put the drug under the tongue or in the vagina up there. So I think that is the most commonest one. Probably myself, yes. I think I know. So what is the success rate of induction of labor in this part of the world?
Oh, induction of labor, fairly, we do well. We do well. We get a lot of people succeeding and then getting through with induction of labor. Quite a few might not work, and then that might be challenging. So, but we do well. Most of the people we do, quite a number of people, especially you do it when it doesn't work, you rest them. Sometimes the medicine too could be part.
Okay.
So sometimes we will do and we'll go and change the medicine. We are getting the medicine for one supply, we go and change the medicine for another supply, then boom, it works. Sometimes you just let the woman be, let her relax.
Okay.
And then you try and it works. So it's not 100%, but majority we are able to get them to labor and do well.
So are there any complications that could arise? I think you said something like that, but then let's ask again. Are there any complications that could arise during this process to either the mother or the unborn baby?
Yeah, so induction of labor is not without complications. So we need adequate monitoring and care for the mother and the baby inside. For the baby, one of the things that can happen is that the baby can have what we call fetal distress. Fetal distress is like when you realize normally what we do is that when the baby is inside there during the labor, we attach some things to the mother's abdomen. Sometimes we can actually go inside and attach the baby directly. Wow. So induction of labor sometimes will put too much pressure on the baby, and the baby's heart can beat fast, or it beat then now it becomes tired and beats pa. It means the baby is having problems, fetal distress.
Okay.
Another thing is that there could be uterine rupture. The uterus can burst. When the uterus bursts, the baby can die. There's something also called abruptio. When the placenta can remove from where it is attached. Baby is still inside. Baby is not breathing yet. So if it's inside, the baby is not getting food. It's not getting anything. If the placenta separates, prematurely separates,
okay,
the baby can die. So this is some of the things that can affect the baby. The mother can get uterine rupture. The uterus can burst. The mother can undergo, it's painful, it can be stressful to the woman. And also it increases the chance of the woman having operation. Okay. These are some of the complications that the woman and the baby can have.
So do you make all these informations available to a woman who might undergo an induction of labor? Do you take them through all this counseling and all this process?
Yes. So every doctor, before you do an induction of labor, actually the woman should sign.
Okay.
After you have counseled her, tell her that these are the reasons why we need to do it. These are possible complications. Of course, the complications are not common, but we have to let you know. We also have to, so anywhere you are doing, when you're doing induction of labor, you should have facilities that you can do cesarean sessions. Because when you do the induction of labor, it fails or there's a complication, quickly you have to go and operate.
Okay.
So these are some of the things you have to. So you counsel the person, let the person know all these things before we start the process.
So who does an induction of labor?
Induction of labor is done by a doctor.
Okay. So there's.
But most of the time we do in conjunction with the midwife. We do it as a team. And that we can get anesthetists to support us to give them pain relief. So it's a team, but most likely it's led by the doctor. Yes.
Let's go for a short commercial break. When we come back, we'll have our tip for this episode.
In the first 2 years, your baby will experience amazing growth in so many ways. To fuel it, they need the right nutrition. With Cerelac, 1 bowl of goodness a day provides the wholesomeness of carefully selected grains, the Iron Plus, which helps support brain development, and the yummy taste baby loves, assuring you the right nutrition in 1 bowl. Cerelac, it's all good, Mom.
This advert is FDA approved.
Welcome back. If you just joined, it's still the Pregnancy Care Show, and on today's episode we are looking at induction of labor, where Doc made us aware that induction of labor is when the labor is started for you to continue naturally or spontaneously. So Doc, what is your final word to our viewers? What do you want to tell them about induction of labor?
To our viewers, I want to say that induction of labor fairly is safe, and before we do induction of labor for you, there's a reason why we want to do it. Don't get so worried and so scared when you hear induction of labor or forced labor. Sometimes there's a reason for doing it, and then we always make sure there's a reason before we need to do it. So don't be scared. And then we are always there to help you, to monitor you, to support you and the baby. Don't be scared.
Thank you so much, Dr. Sekom, for coming on the Pregnancy Care Show. We are grateful for having you here once again.
It's a pleasure.
So today's episode was about induction of labor, and we've learned a lot on what induction of labor is. If you don't understand anything on it, speak to your doctor, find options, and let your doctor give you details of what the process is going to be like. The show was brought to you by Cerelac. If you have any questions, any comments, send them into our comment section on all our social media platforms. Keep subscribing to our YouTube channel, send in your questions or your comments on my page at dede_gawu on Instagram. Thank you for watching this week's episode. See you next week.